Hey everybody, today we're going to talk about the notes on muscular movement types and names. So I'm going to go through the notes this way. This way you have the recording and you can go back and listen in case there's anything that you need to check out. So a quick little reminder here, in a previous set of notes we talked about fascicles. And remember, the fascicles are the muscle fibers in the skeletal muscle. So there are different ways that these fascicles are arranged, and because of the way they're arranged, we can classify skeletal muscles as one of the four things. First, we have parallel muscles, and then we have convergent muscles, we have pinnate muscles, and then circular muscles. And you can take a look at the diagram over there to kind of see where these different things are located, and we're going to talk about each one of these in a second. So the first type of muscles that we're going to talk about are the parallel muscles. And you can see that the fascicles are parallel to the long axis of the muscle. These are the majority skeletal muscles in your body. Some of these things might be flat in structure with broad attachments, and others might be plumb and cylindrical. So some examples that you can see the bicep brachii, you can see your abdominis muscles, and then the supinator muscle. The next type of muscles are the convergent muscles, and these extend over a broad range of area, and they come together or converge on an attachment site. So one of the examples that we can see over there is the pectoral muscle. And just think about your pectoral muscle. As it's broad across your chest, it moves, and as it gets closer to the shoulder, it kind of converges to a point and attaches to a tendon. All right, so a third type of muscles we have are the pennant muscles. And these fascicles form a common angle with the tendon. These also contain a lot more muscle fibers than parallel muscles, producing more tension in the muscle. There are three different types that we see. We have the unipennant, the bipennant, and the multipennant. And looking at the diagram on the left, it kind of shows you where each one of these things is located. So the unipennant muscle is located in the forearm, the bipennant muscle is located in your quadricep, and the multipennant muscle is located in your deltoid. The fourth type of muscle we're going to look at is the circular muscle here. The circular muscle are concentrically arranged around an opening. These things are usually around hollow organs and digestive tract and urinary tracts. So again, think of things like the sphincter muscles, which open and close. The orbicularis oris is another example of that. The next thing we're going to do is talk about the muscle movements, types, and the names. So there are two different types of body movements. We have origin and insertion. For the origin, you can look at the diagram over there on the right, and we see that the origin of the arm here is located up in the top part of your shoulder. And that's the point that is attached to an immovable or less movable bone. The insertion point is a point where you can see over there on the diagram that's kind of more attached to the elbow, which is more of a more flexible, allows more movement in the bone. So with interactions in the skeletal muscles of the body, you guys might have heard of things like push, pull, or opposites or something like that. So let's just kind of give them their actual official names. We have the agonist or the prime mover, and that's the muscle that is the major responsibility for causing a particular movement. The antagonist is the muscle that is going to oppose or reverse that movement. Now, the example I have here is your arm, your bicep, and your tricep, and they actually both work as an agonist and an antagonist. It just depends on what you're moving. And obviously, if you're flexing your bicep, you're acting as the agonist because you're the primary muscle moving. The antagonist then, which is working in the opposite effect, would be your tricep. Other movements in your skeletal muscles, you might see you have synergists and fixators. Synergists are prime movers by producing the same movement or reducing undesirable movement. An example here is the teres major, which is going to help get your shoulder to extend to its full capacity and help able to fully move it. The fixators are specialized synergists. They're going to hold bones still or stabilize the origin of a prime mover. So all the tension can be used to move the insertion bone. So an example of this will be the postural muscles that stabilize your vertebral column. All right, so we're going to talk about a couple different body movements. Pretty much everything that is on these next few slides, they're going to work as agonist and antagonist pairs for the most part. So we're going to go through and just kind of briefly talk about each one of these things. We have two different terms here. We have flexion and we have extension. So flexion is pretty straightforward. Whenever you flex something, you're pulling it towards you, like you're flexing your bicep muscle. There's also lateral flexion, which you can use in your neck when you move your head side to side or left to right. And then the opposite would be extension. So if you have flexed your bicep muscle and then you extend it, you're letting it back out, that obviously is extension. All right, you can actually go through this thing called hyperextension, or you might have heard that term before. If you hyperextend something, that's actually taking the joint past 180 degrees, which could cause damage to the joint or the tendons in that. Might have happened through a sports-related injury or something like that, or maybe you fell, I don't know, slipped on ice or something like that. You could have had a hyperextension. All right, the next two body movements we see, we have adduction and abduction. You can see in the diagram over there on the right, when we talk about abduction, if your arms are at your side, you're moving them up so they're kind of parallel with your shoulders. And then you have adduction when you move them down, back down to your sides. You can think of it a way for adduction, if your arms are out straight and you're bringing them down to your side, you're adding more width to your body. Abduction, again, you're just pulling them away, okay? You're pulling them up. All right, the next two that we have is we have rotation and circumduction. These are kind of similar. They are different though. For rotation, you can see it's a movement of the bone around a longitudinal axis. So you can rotate your head left and right. You can also kind of rotate your leg left to right, like as in the diagram over there. Circumduction is a little bit different. You're going to move your body in a circular motion. So if you hold your arm out straight, you can kind of twist your wrist and move it, and it's kind of more of a circular motion. Now, obviously, you can do that if you do arm circles with your arm. You can kind of move them in a circular rotation. All right, the next two body movements we have is pronation and supination. You guys might have heard these terms before, especially if you're a runner, or maybe when you go try on shoes, you might see shoes that are designed for supination or pronation. You can see in the diagram over there, if you have a pronated step, your step is kind of leaning more inward. And if you have a supinated step, you're more on the outside. And you could actually take your shoe, if you use your shoe a lot when you run and stuff like that, you can kind of look at the bottom and see where it wears out. And if it's wearing out from one side or the other, you can tell what type of runner you are. All right, the next two body movements we're going to talk about is dorsiflexion and plantar flexion. So what I want you to do is hold your foot out straight, like kind of dangle it down. If you bring your toes up towards your body, that's dorsiflexion. So again, we're moving that up towards our body, towards our shin. And then plantar flexion, doing the same thing, you're just moving your foot downwards, so you're kind of pointing your toes down, and that's the difference between those two. All right, so the next two body movements that we see, we have inversion and eversion. You can see from the diagram over there on the right, and you can do this with your feet. As you hold your feet out straight, you kind of dangle them off a chair or something. As you turn your feet inward, you can see that's inversion. As you try to turn them outwards, again, away from the midline, that's eversion. All right, the next two that we have is protraction and retraction. So you can see over there the diagram, protraction means you're sticking something out. So if you sit there, you can kind of poke your chin out. As you poke your chin out, that's protraction. As you kind of bring it back in, that's retraction. You can kind of do the same thing with your shoulders as well. You can kind of push your shoulders out in front of you, and then you can bring them back towards you. All right, the next two body movements we have elevation and depression. So again, you can do this one at home while you're going through this. Whenever you shrug your shoulders, you're shrugging them up towards your head. That's elevation. And then when you kind of relax them and you can kind of sink them down, that's depression. The same thing works if you want to use your mouth as an example. When you open your mouth, that's kind of a depression. When you close it back up, that's elevation. All right, and the last set of body movements that we have here. We have opposition and reposition. For the opposition here, you can take your hand. As you move your thumb to touch your other fingers, that's opposition. So again, thumb touching your other fingers, that's opposition. When you take your thumb and put it back out, that's reposition. All right, that's all the notes that I have for you guys today. Just kind of go through these. Make sure you know the different body movements and the different examples that I showed you guys today. And that's all I got for you.